डॉक्टर श्रीकांत का परिचय हम लोगों ने यहाँ हमारे हॉल को दिया है, हमारे सारे ऑडियंस इन द हॉल एज वेल एज पीपल हु आर कनेक्टेड थ्रू द इंटरनेट, हम लोगों ने दिया है कि मैंने बताया कि आई वाज फॉर्चुनेट इनफ टू बी with him in science college. We have studied together, and now he is a professor and director of Department of Pediatrics in Lady Hardinge Medical College. एंड आपके डिग्रीज को हम लोग आधा समझ पाए, आधा समझ नहीं पाए।
नहीं
तक तो ठीक था, उसके बाद की यात्रा नहीं हो पाई हमारी।
नहीं विल डू, क्योंकि मैं तो आपके इस लर्नर ग्रुप में काफी इग्नोरेंट हूँ। मैं प्रोग्राम देख रहा था तो सब काफी विद्वान लोग, पंडित लोग हैं। मैं तो एक जस्ट डॉक्टर एंड रिलेटेड टू हेल्थ साइंस। आई डोंट नो कैसे आप लोग इस लेक्चर को ये करेंगे। Thanks for the patience you all are having to, and then I must thank Dr. Shomesh for giving me the opportunity. Thanks to the director and the chairman of the hospital, the college to interact with such august speakers, faculty, and audience as well. Okay, my topic, I had discussion with Dr. Shomesh how to go about it. So what I will do, I will kind of link, since I'm a pediatrician, that is specialist of children, I will try to link the environment and child health and relatively covers few of the scientific approaches or the whatever literature is available vis-a-vis common things. The audience, I believe audience must be some young audience as well, they're supposed to know. So as we all know, the pediatrics we generally cover from newborn to the age of 18 years, but even it starts before that. Well, first slide. If you look at the health, generally we associate doctor with treatment of the disease. Fine. During COVID time also, doctor played an important role along with the other health worker. But it's not merely the treatment of disease. If you look at it, if you look at the definition of WHO, we say health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. It is a definition, but we as a doctors, we as a community sometimes concentrate too much on the disease part. And as propagated by our rishis and munis, if the spirit, if the chit is okay, if you follow a good lifestyle, good behavior, probably chances of falling ill is very low. Even if you fall ill, the chances of recovery is much more than going to a doctor and taking various types of medication. So health is a complete package in which we normally cover both the physical, mental, and social, and also spiritual as well. This has also got a fourth element, that is spiritual element, that links with your mental health as well. If you look at the dictionary definition of health, it's almost same. Health is the condition of being sound in body, mind, and spirit, especially freedom from physical disease or pain, right? So this is very important to know. So then what is the environment? Since I'm linking up with the health and environment, if you look at the environment, then probably environment is also something which normally associated with physical environment. Is nothing like that. Physical is just what is visible to us, but other determinants of health or which are around us, basically the social environment, the biological environment, there are other things as well. Physical will include macro and micro, right? So this is very important to know what are the types of environment. When it comes to physical environment, it is the macro environment, that is the food, water, air pollution, that we every day see in our newspaper, and it is definitely responsible for many of the diseases in children. But the important part which you often miss out is our micro environment. And what is micro environment? The environment we get at home with our parents, with our siblings, whenever interacting with people. There are workplace, like we're interacting with your friends or teachers. They also have a lot of bearing on our overall health. And if you look at the social environment, next slide, please. Social environment, that determines our religion, the way religion shapes our, you can say, personality, our upbringing, whatever we follow in our day-to-day life. Then race and gender is very important. Whether you are going in a setup where gender equity is being practiced at home or not, or in the practice in hospital or in college or roundabout to, that will have a lot of bearing when you grow up as a person. The socioeconomic status, obviously, with the economic condition you have, with the type of education, occupation, and family composition. These are very, very, very important things which are very important whenever you're talking about social determinants of health. Right. Then coming to next slide. So social determinants of health include conditions we are born, live, work, and grow. And humans, kind of, our brain is growing. I mean, it's kind of, we possess a kind of plasticity during the early years of life, especially during the first 2-3 years of life. In fact, you'll be surprised to know brain growth is almost almost 2/3 complete by the age of 2 years. Only 1/3 is left after that, but still brain continues to grow till mid-20s. So there still is scope. So obviously, the major functions brain acquires in the first 2-3 years of life, but the other cognitive, other higher functions are continuing to grow. Right? I will discuss that in detail slightly later. So we kind of know how to change, how to react to the environment, how to adjust to the environment, and we are exposed to both the positive and the negative, and helped by your parents, helped by your own instinct, helped by your friends or our teachers or gurus, we kind of know how to tackle that situation if it comes once again. So again, social environment has a bearing on your higher mental function that we call the cognition or educational attainment. Then risk-taking behavior. Everything is not always good. I'll list what is risk-taking behavior. Then your emotional and psychological well-being, that is very, very important to remain healthy. And lastly, your physical health as well. So if you look at the whole continuum, next slide, please. Here there are, can you see this slide?
Yes,
yeah.
sir.
Yes.
Yes,
Here, if you keep yourself as an individual, that is again, individual as a person, a baby is born, baby has inherited a lot of things from his parents, few things from his grandparents, and even few things from his great grandparents. Meaning, we are born with a certain kind of genetic, I can say, that we have inherited something from our genes. That is the nature. And that when the baby is born, when the baby is born, baby is being looked after by his mother, then father, then other elderly people, then gradually even the domestic help and everyone. Then goes to school, then college. Here is the nurture. So there is a debate between nature and the nurture. What the nature contributes to the personality and how much contribution is done by the nurture. There are extreme views. One say genes is the only thing that determines the overall personal achievement, or you can say your capability, so the attainment in terms of education or in terms of, say, his skills set in some. Yes, you must have seen sometimes sons and daughters of musicians, they become musicians. But is that so every time? No. For example, Neeraj Chopra, our only gold medalist winner in athletics, in Olympics, his parents are not at all related to athletics. He was born with some kind of, say, ability. Definitely, yes, being a racial, you can say, advantage, being born in Haryana. But after that, he practiced, and that is his learned behavior. That is, the nurture kind of helped him to attain the full potential. So there is always a debate between nature and the nurture, but the middle path, most of the people believe that definitely we're born with certain things, but end of the day, in nurture, there are certain behavior you learn from your experience, and that shapes your overall personal acquired potential. And this is influenced by the social environment and the other environment determinants which I had talked about. So environment does not mean always the physical in terms of air, noise, or something like that, but also the environment, microenvironment which surrounds you. So it is the interaction between this thing, an individual grows into the society and rather helps to deal with the daily stresses or daily, you can say, daily nuances of your day-to-day life. Now coming to so this is the interaction. It can very well explain by this pie diagram. There is always an overlap between the health, environment, and the community. And ultimately, it is an interaction. A balance has to be maintained. A person who kind of maintains a balance, we can say, is one of the person best. I won't say the best person, but probably the best person fitted to deal with any kind of challenges in the life, which is very, very, very important. Right. Next slide, please. Now coming to the health promotion. When we talk of health promotion, it is basically with not treatment. Actually, kind of more than the treatment and the prevention. Promotion means it is the process of enabling people to increase control over, to improve their health, to reach a state of complete physical and mental and social well-being. And group must be able to identify, realize their aspiration so that they can reach their potential. So health is therefore seen as a resource for everyday life, not the objective of living. Health is a positive concept emphasizing a social and personal resources. Therefore, health promotion is just not the responsibility of the health sector, but it goes beyond that. So if you look at it, health promotion, and when you talk of holistic care, holistic means wholesome care. Holy means the Greek word start from wholesome. It includes all your physical aspect, social aspect, psychological aspect, and spiritual aspect. And this aspect is one of the aspect which is being kind of not too much seen in modern aspect, modern medicine, I could say. But gradually people are realizing, not only in the India, but Western people are taking cues from our Indian so-called literature all around. In fact, you'll be surprised to know we have a textbook of medicine, that is Harrison, we call it Bible of Medicine, in which they have got a chapter on the complementary medicine, in which yoga and some other Ayurvedic thing with proven benefit they feature in that. It's not that. And recently our government is also included yoga as one of the curriculum in the first MBBS, and I'm sure this is going to have a long-lasting effect, not only learning medicine, but also making doctors more, you can say, more capable as far as his communication skills and his other skills are concerned. In fact, many a time, I remember I was brought up in a place called Patna. We had a family doctor, Dr. Samadar. Those who know in Patna know him very well. He has a road named after him. Dr. Samadar was one person. He used to see me, my father, my mother, everyone around the mohalla used to go to him. And most often, he used to treat all of us and he always used to get well. Apart from the medicine, he made a very good diagnosis, very good, communicated very well. And end of the day, we can say he was a complete doctor. But with modern advancement, this kind of so-called complete doctor's part, a family doctor, is missing from our lives. Nowadays, we go to a specialist. पेट में दर्द होता है तो gastroenterologist. ठीक है? अगर आपके सर में दर्द है तो neurologist. It is because end of the day, medicine is basically, we're not treating the disease. There's a lot of things behind the actual pain, behind the actual symptom. The way we react to our any symptom, that is more important to treat. So gradually, in fact, that is that part is very much highlighted in the nursing profession. You can see many the good nurses, they have a very good empathetic side to it. Good doctors have very good empathetic side to it. And more than half of the illness kind of cured when a person bears this kind of thing. So the holistic part is very, very, very important. And holistic principle says that all people have natural healing power. Definitely we facilitate healing, but definitely it is end of the day, the person has to exercise his own healing power. Either they come from within or they come from their experience. A patient is a person, not just a disease. This is very, very important. We tell our students, always treat the person, not the investigation, but that is not happening. Gradually, what is happening, we're doing excessive investigation, we're treating the investigation. So it is time to take a relook at it. And suitable healing therapy needs a team approach. It's not the one person, but probably it will require not too many specialists, but many persons who are attached to, who are close to you. And patients and healthcare professionals are collaborators in the healing process. So treatment comprises the fixing of cause of the illness, not just the relieving of the symptom. Next slide, please. So what is life course approach? This life course approach is a very interesting approach. In fact, the whole life is divided into various parts, and it has been decided that all these parts are in continuously. For example, when a lady becomes pregnant, the fetus, what we call the baby which is inside the mother, is called a fetus. He or she stays there for about 9 months, and that is the environment for the baby. Whatever the mother provides, whatever the nutrition mother takes, that is going to the baby. So this is very, very important to know that it's not in isolation. Once you're treating the mother, when you are promoting the health of the mother, who are actually going to benefit the baby. And when the baby is born, it is called a newborn. Then baby gradually starts sitting, then standing. We call it infant, we call it toddler. Then this baby gradually becomes age of 10, 11, 12, we call it teenager, adolescent. After that, after 19, after 20, he becomes a young adult, then an adult. So what the life course approach says, different life courses are linked to each other. So which should not be it should be individualized, but at the same time, the care, the promotion care, the preventive care, the treatment part should be kind of coordinated, should be linked to each other so that the continuity of care is maintained. So if you look at next slide, please, we look at this diagram. The baby is born, that's what I told. The baby becomes infant. In medical term is less than 1 year, then childhood, adolescent, adulthood, and finally the female gets pregnant. Again, this cycle continues. This is the life course approach. Now, in fact, the WHO has kind of various packages, health packages, depending on the particular age group. There are packages for newborn, there are packages for childhood, there are packages for adolescent, and also for geriatric, the old patient. That is coming in India especially, we are getting a large number of geriatric patients. Right. So if you look at next diagram, please. So this is life stage. When the lady is pregnant, the baby is born, and gradually this is the life course approach which I am talking about. So end of the day, it is the healthy environment. You can say this is the center of all the environment is healthy. And I told you, environment, both the physical, social, mental, spiritual, it kind of touches all the age group of a human person. So end of the day, it is the environment who actually ultimately leads to the development of a full-grown, healthy person. Now, let's take the concept of, in the next few slides, I will go from various age group and discuss some of the important relevant points. This is what is the first 1,000 days. These days, you must have been seeing our Ministry of Health and Family Welfare, and even our Honorable Prime Minister talking a lot about Poshan Abhiyan, nutrition. And nutrition is not only for the baby or the child, it is for the all age groups, especially since in India we have children, many children are grossly undernourished. So our focus area is mainly children and in adolescent female, right? So what are these first 1,000 days? First 1,000 days include when the baby is conceived inside the mother's womb and till the baby is born and attains 2 years. So roughly the total days are 1,000 days. As I told you earlier, these 1,000 days are very important for the development of the brain, right? Because brain growth is maximum. As you all know, brain is the central executive officer of our body. So whatever the growing brain gets the nutrition, if nutrition is proper, if you can say environment exposure is proper, then the brain will be growing optimally and the person will achieve his perfect health and grow up to be a good individual. So the focus is not that when the baby is born, you start giving vaccination and start treatment. The focus that the mother should be treated, not treated, rather healthy nutrition should be promoted for the mother. Next slide, please. This is a very beautiful line for Rabindranath Tagore, probably signifying the maternal aspect. The smile that flickers on baby's lips when he sleeps, does anyone know where it was born? Yes, there is a rumor that a young pale beam of a crescent moon touched the edge of a vanishing autumn cloud, and there was smile first born in the dream of a new morning. So this is kind of reflection of the mother, and so much, as I told you, much of the human development is completed. This is very interesting thing. David Barker was a scientist, I must tell you. In 1980s, he followed up babies who were born for 30, 40 years. Imagine, that is so difficult to follow. And he had record of all those things. Then when this babies grew, he found that some of the babies, some of the adults had particular problem like hypertension or heart disease, dying of heart disease, or having coronary artery disease, or brain stroke and all those things. So he found, when he reviewed their history, went back, found the record, he found, and also he followed some of the children. Some of these children had a common thread. And his concurrence was that much of the human development is complete during the first 1,000 days after the conception, and children and adults' health risks may be programmed. Again, maybe, we do not have a definite evidence, may be programmed by a nutritional status during this period. And this is, in fact, very interesting, you can say, concept. It was given by that. And he raised the theory of possible effect of inherited genes and environment factors, which I was talking about earlier. During this critical period, this is the growing brain, which is inside the mother womb, and the first 2 years, if some insult is there, that is going to have a long-lasting effect. And so with the advent of this so-called metabolic or lifestyle diseases, probably this is the time we should focus more on the first 1,000 days of life, and that is rightly advocated by the scientists, and our government is trying to focus the 1,000 days. So David Barker's theory gave rise to his development origin of health disease theory. Right, next slide, please. So this is our government program, that is the 1,000 days, depicting 1,000 days journey of the first 1,000 days, and it is given rolled out under the program Rashtriya Bal Swasth कार्यक्रम. Okay. So the first 1,000 days, I told you, the most crucial, and malnutrition. Malnutrition means not only undernutrition, even overweight and obesity is a form. Mal means different kind. Next slide, please. Yeah. Malnutrition is associated with numerous health problems such as obesity and undernutrition. Though in India, undernutrition is much more common as compared to obesity and overweight, but still overweight and obesity is on the rise alarmingly, so much so that more number of adult population in our urban setup are more overweight or obese, right? Amongst the so-called economically well possessed group. So this is the importance. The first 1,000 days is very important, not only for physical health but also for the what is called the psychological health, right? This is very, very important. So this is how it is divided. Pregnancy, that means the focus should be on the pregnant mother. In fact, they say before conception is made, one has to be mentally very clear. Yeah, one has to be mentally very sound. One has to know what is it. The both father have to actually plan their pregnancy in the proper state of mind, so that whatever state of conception is inside the mother is kind of can grow up to be a good potential human being. Then when the pregnant lady should get proper follow-up, and nutrition is very, very, very important. Here I would like to talk about a kind of what you call intergenerational cycle of malnutrition. This is very, very important point. Next slide, please. Because what I'm going to tell you, as I told you earlier, what happens, like suppose a mother, a teenage mother is giving birth to a baby. What happens? Teenage means you will surprised to know, in fact, you will surprised to know that more than what you call nearly in India, as per National Health Family Survey 4, 27% of the mothers were married before the age of 18 years, in spite of such a law being in place that is legally not right. Right? This is, I'm talking about government data. NFH is 5, it has diminished slightly. But again, what I am saying, a teenage mother itself is growing physically and brain-wise and everything. Her requirement is there. As we all know, we always give more amount of milk and all those nutrition when the lady becomes pregnant. Now imagine a teenage mother, she is getting the fit for her own growth. At the same time, a fetus is there inside her womb. So kind of both this mother and the baby are fighting for the same nutrition, isn't it? Look at the environment pressure, same nutrition. What happens at the cost of the baby baby which is born is not a normal weight baby. It is delivered much before the 9 months. Either you call it premature baby, or baby's growth is not proper. We call it growth retarded baby. So this baby is growth retarded, who is small baby, because a teenage mother, it also increases the risk of death in the teenage mother as well as the risk of death in the baby as well. Right. Now when this baby is growing up, ultimately this baby become a malnourished child. Now when suppose it's a girl, this girl is going to be a, you can say, undernourished adolescent, undernourished teenager. And God forbid, if this again married again the cycle, again she will give rise to birth to a, you can say, underweight baby. And this cycle of malnutrition continues. A undernourished mother giving birth to an undernourished baby, and this going to be undernourished adult ultimately, or short adult, or stunted adult, and this is called intergenerational cycle of malnutrition. So here is the role of environment. The environment is mother's womb. We have to feed the mother. Apart from the nutrition, we have to ensure that mother is not married before the age of 18, right? So that she has attained that full physical growth. Let her grow, then marry, then let her bear children. So proper counseling, proper advice, proper thing need to be given at all the level, at the level of family. I know there are compulsions that many families, especially those living below the poverty line, but end of the day, it is the part, we can say, it is the role of our health system so that we can inform them so that they can reach to us and we can help them to take a kinds of, say, a proper decision, right? So this is very, very, very important. So this is the intergenerational cycle of malnutrition. Next slide, please. That is the power of 1,000 days. Now coming to the, now that baby is born, I will just take out one or two important aspects, then I will discuss. This is very important. You must have heard about breastfeeding, स्तनपान. आजकल हर जगह एडवर्टाइजमेंट आता है कि बच्चे को माँ का दूध पिलाना है. ये तो हमारे सदियों से जमाने से चली आ रही थी, isn't it? स्तनपान, breastfeeding. We call it exclusive breastfeeding, scientific term. Exclusive breastfeeding क्या होती है इसे देखते हैं. अर्ली इनिशिएशन, बच्चा पैदा होते ही 1 घंटे के अंदर उसको माँ का दूध पिलाना है. लोगों को लगता है डॉक्टर साहब ऑपरेशन से बच्चा आ गया. ऐसा भी देखा गया है, ऑपरेशन के बावजूद भी बच्चा जैसे ही माँ होश में आती है, हम बच्चे को माँ के स्तन में लगा सकते हैं और बच्चा माँ का दूध पी सकता है. बच्चे को पानी के अलावा कुछ नहीं देना है पहले 6 महीने तक, और 6 महीने के बाद फिर हमें, जिसको अन्नप्राशन बोलते हैं, बहुत सारे ईस्टर्न पार्ट ऑफ इंडिया में, उड़ीसा में, बंगाल में, कि जब 6 महीने के बाद, आप ट्रेडिशन को देखिए कितना अच्छा ट्रेडिशन, 6 महीने के बाद हम लोग सेलिब्रेशन करके, फेस्टिवल करके हम बच्चे के मुंह में दाना डालते थे, अन्न डालते थे, राइट. इसका कुछ उसका दैट मींस उस समय ऋषि मुनियों को, हमारे गुरुओं को पता था कि 6 महीने तक माँ का दूध सफिशिएंट है. उसके बाद माँ के दूध के साथ साथ हमें ऊपर का चीज भी देना है. अगर ऑप्टिमली हम इसको दे पाए, 2 साल तक हम माँ का दूध दे सकते हैं. दिस इज कॉल्ड एक्सक्लूसिव ब्रेस्टफीडिंग. So timely introduction of solid foods or complementary food along with the exclusive breastfeeding makes the child grow normally. इसका concept कहाँ से आया? ये ऐसा नहीं कि अभी आया. ये if you go back, next slide please. Can you see this figure? Can anyone? I mean, this is in fact from Egyptian. You can say Egyptian sculpture from the pyramid. You can say the Egyptian lady is feeding a newborn baby. ऐसी बात नहीं था. Can you see this photograph? Yeah. सुमेश, मिल रहा है ना? अच्छा, ऐसा नहीं कि हिंदू भी, इनफैक्ट 2-3 महीने में खजुराहो गया था. Those who have not been to खजुराहो, I tell them please go to खजुराहो. It is a wonderful piece of art. खजुराहो जो टेम्पल है, वहाँ पे जो हमारे गाइड हमारे को शेयर करा रहे थे, it is about the temple was built, लक्ष्मण टेम्पल के नाम से जाना जाता है. This is the temple you must have seen, those who have seen. It is built somehow around 900 to 1000 AD के आसपास, ठीक है, 1200 साल पहले बना हुआ है. एंड इंटरेस्टिंगली, हिंदी में बोले
जरूर सर.
इट्स ओके.
हाँ एकदम
ठीक है. तो ये बड़ा, ये नेक्स्ट स्लाइड प्लीज. आप ये नेक्स्ट ये देखिए, ये मैंने फोटोग्राफ लिया, आपको दिख रहा है 1200 साल पहले ये लेडी का फोटो है और बच्चे को हाथ में पकड़ी हुई है. तो 1200 साल पुराना हमारे टेम्पल में स्कल्पचर में आप इमेजिन कीजिए. तो इसका मतलब ये जो परंपरा कितने सालों से, सदियों की चली आ रही थी. बट थैंक्स टू द यूरोपियन, जो रॉयल, ये जो कंसेप्ट, जो ब्रेस्ट फीडिंग की जो ये थी, वो धीरे धीरे कम हो गई थैंक्स टू द यूरोपियन रॉयल्टी. उन्होंने, उनको लगता था कि ये शायद माँ का काम नहीं है. उन्होंने क्या, उन्होंने नर्स को एम्प्लॉय किया कि बच्चा पैदा होने के बाद नर्स अपना दूध पिलाएगी. उसको हम लोग बोलते थे वेट नर्स. और एज यूजुअल हमें बाहर का चीज दूर से काफी बोलते हैं, सुहाना लगता है डोल जिसको. तो वो कंसेप्ट धीरे धीरे इंडिया में भी आया और उसके बाद कंपनीज आती गई, मॉडर्न थिंकिंग, एडवर्टाइजमेंट. आज की तारीख में यू ऑल नो एवरीथिंग इज मार्केट ड्रिवन. आपकी जो एडवर्टाइजमेंट, आपके घर में बच्चे आप देखो 1 साल तक तो कुछ, जिस दिन बच्चा आपका बर्थडे पार्टी की आई थी, मेरा ऑब्जर्वेशन है, पहला बर्थडे पार्टी जब बच्चा अटेंड करता है अपने फ्रेंड का, उसके बाद से उसकी तो पूरी टेस्ट ही बदल जाती है. वो कोक और चिप्स के अलावा कुछ नहीं मांगता है, या चाउमीन के अलावा, ठीक है. तो कोशिश तो हम जरूर करते हैं, फिर कहीं ना कहीं हमारी जो ये रह जाती है. तो कहने का मतलब ट्रेडिशन और हिंदू एंड ऑल्सो इंडियन, यू कैन से इट हैज अ लॉट ऑफ, वी कैन से थिंग्स वी कैन एक्चुअली इनहेरिट, बट समहाउ डाउन द लाइन हम लोग उसको भूल रहे हैं, बट अगेन वी आर गोइंग बैक. एंड ब्रेस्ट फीडिंग, इट इज इन साइंटिफिकली प्रूवन, it is the best food for the baby, best ready made food for the baby, wholesome food for the baby. And even poor से poor mother भी अपने बच्चे को दूध पिला सकती है. नेचर ने, भगवान ने मदर को इस तरह से बनाया है, और ये देखा गया है इन बच्चों में बीमारी से मरने की जो चांसेस है 10 गुना बढ़ जाती है अगर वो ब्रेस्ट फीडिंग के बदले दूसरे तरीके, दस्त, डायरिया की. नॉट ओनली दैट, बच्चे की IQ भी देखा गया ब्रेस्ट फीडिंग में, ब्रेस्ट फेड बेबी में अच्छी होती है. एंड ब्रेस्ट फीडिंग आल्सो प्रोटेक्ट द मदर फ्रॉम सम फॉर्म ऑफ कैंसर and keeps the mother healthy as far as body weight is concerned. For the ladies who have their bahus and young sisters at home, this is the advice one advice I'd like to give. So always advise for exclusive breastfeeding. Why advice I'm giving? Because in spite of our best measures, still exclusive breastfeeding as per the National Family Survey 5 that is conducted in 2019 and 20, it's still only 63%, still 37% are still not exclusively breastfeeding. So there are a lot of factors in play. The pressure from the marketing forces, the pressure at home. Sometimes घर वाले ही बोलते हैं कि भाई दूध तुम्हारा कम आ रहा है, माँ के दिमाग में बैठ जाता है, माँ को लगता है शायद मेरे में शायद कोई कमी है. तो हम लोग समझाते हैं कि बहन जी देखिए 9 महीना आपने इतना मुश्किल करके बच्चे को पाला है, अब क्यों 6 महीना आप क्यों बच्चे की ये करना चाहते हो. मेनी टाइम दे कम अराउंड, प्रॉपर काउंसलिंग देनी पड़ती है, मदर को कॉन्फिडेंट बनाना पड़ता है. साथ में जो मदर के बच्चे के फादर हैं, बच्चे के घर में सास हैं या बच्चे की मदर है, नानी है, they have to be convinced, they have to be taken in confidence. You have to go for breastfeeding. Don't apply undue pressure, but don't pressurize to give top milk. Right? आपने कभी देखा है गाय के बच्चे भैंस के बच्चे को दूध पिला रही? Never. So that is one of the example we tend to give. This is very very important. This is one aspect I would always like to say कि newborn में एक चीज एडवाइस करना है, the common person advice for exclusive breastfeeding. ये जो हमारी आशा वर्कर है एक कम्युनिटी में दिखा रही है इस तरह से बच्चे को ब्रेस्टफीडिंग कराना है. नेक्स्ट ग्रुप में टेक ओवर करूंगा एडोलेसेंट एज ग्रुप, बिकॉज एडोलेसेंट एज ग्रुप एक बच्चे पैदा होता है, शुरू के 1 साल में जो ग्रोथ होती है बच्चे की, उतनी ज्यादा ग्रोथ शायद लाइफ स्पैन में कभी नहीं होता है. आप एग्जाम्पल के तौर पे आपको बता दूं, सिंस आप लोग बहुत अधिकतर लोग नॉन मेडिकल हैं, रफली नॉर्मल बॉडी वेट बेबी का बर्थ वेट 2.5 किलो का होता है. तकरीबन 1 साल के आसपास बच्चे का जो नॉर्मल वेट 10 किलो के आसपास होता है. तो आप देख रहे हैं बच्चा कितना गुना बढ़ गया है, ऑलमोस्ट 400%. सो इतना ज्यादा ग्रोथ, आप समझ रहे हैं इतने ग्रोथ के लिए बॉडी को कितना ज्यादा न्यूट्रिशन चाहिए होगा. राइट? उसके बाद और कभी बच्चे का इतना ज्यादा ग्रोथ नहीं होती है. नेक्स्ट जो ग्रोथ होती है बच्चा जब एडोलेसेंट होता है, एडोलेसेंट एज ग्रुप जैसे मैंने पहले भी बताया था 10 से 19 साल वाले बच्चे को हम बोलते हैं. इस समय नियरली the child gains 25% of his adult height and 40% of his weight. आपने देखा होगा आपने जिसके अपने बच्चे जब एकदम से बच्चे धीरे धीरे वेट में बढ़ने लगते, आज की तारीख में तो भाई तो एकदम से वेट बढ़ता है. और उसका वो भी कारण है, नॉट ओनली न्यूट्रिशन, क्या बोलूंगा मैं, और भी कारण होते हैं. खासकर अर्बन सोसाइटी में आपने जरूर देखा होगा, जो बच्चे क्लास 9 से जो पढ़ाई में घुसते हैं, कोचिंग में जाते हैं, 9 से 12 के बीच में अधिकतर बच्चे हमारे गोलमोल हो जाते हैं. Isn't it? आप देखिएगा हर जगह कोचिंग. I really pity for the children. So there is a pressure. Not only they are getting food, too much pressure कि अच्छा करना है, and they are given all kind of liberty. बेटा तू पढ़ाई कर ले, बस तू जेई में ये रैंक ले ला, नीट कम्पीट कर ले, प्रेसिडेंसी कॉलेज में एडमिशन ले लो, चाहे सोमेश के कॉलेज एडमिशन ले लो, अच्छा तुम्हें करना ही है. ठीक है? तो that also is not very good. End of the day, we gain lot of weight. Some of them are not able to control or restrict their weight. That can give rise to a problem in the life. So coming to the next slide, adolescent. जब adolescent की हम बात करते हैं, इसमें 2-3 चीजें इम्पोर्टेंट है. जैसे मैंने पहले भी बताया था, अर्ली मैरिज, प्रेगनेंसी, इम्पैक्ट ऑन फ्यूचर जनरेशन, उसमें बहुत इंपॉर्टेंट है. अगर न्यूट्रिशन अच्छी तरह से होती नहीं है, खासकर इंडिया में टीनेज मदर की बहुत संख्या ज्यादा है. ये छोटे बच्चे जो हैं, इनके बच्चे काफी छोटे होते हैं. बहुत सारे बच्चे बड़े होके इनमें हाइपरटेंशन, जो बार्कर हाइपोथेसिस की बात कर रहा था, इनमें हाइपरटेंशन की बीमारी, हार्ट की बीमारी, डायबिटीज की बीमारी पाई जाती है. इनके लिपिड प्रोफाइल बिगड़े होते हैं. So really some of them are that. So we have to emphasize कि हमें जो बच्चे की जो शादी है 18 के बाद ही करनी चाहिए. और जब भी बच्चे माँ जब बनती है तो उसमें हमें खासकर न्यूट्रिशन का ध्यान देना चाहिए. अब नेक्स्ट स्लाइड, एडोलेसेंट एंड न्यूट्रिशन की बात करें तो जो एडोलेसेंट एज ग्रुप के बच्चे हैं, इनमें 3 तरह की न्यूट्रिशनल मेनली प्रॉब्लम होती है। अंडर न्यूट्रिशन सबको पता है, जो बच्चा जो दुबले पतले। ओबेसिटी एंड ओवरवेट इज ए बिग प्रॉब्लम इन द अर्बन सोसाइटीज। आजकल आपकी रूरल सोसाइटी में भी प्रॉब्लम देखी जा रही है। ओबेसिटी, दे मे नॉट बी ओबेस, दे माइट बी सेंट्रली ओबेस, उनके पेट बड़े होते हैं। और तीसरा जो है माइक्रोन्यूट्रिएंट मालन्यूट्रिशन, जिसमें कि खून की कमी होती है, हीमोग्लोबिन की कमी होती है, विटामिन B12 की कमी होती है, विटामिन डी की कमी होती है। More than 50% of the adolescents in the age group of 10 to 19 are either thin या छोटे होते हैं या ओवरवेट और ओबेस। ये हमारे इंडिया का सर्वे है, और ये नेशनल बहुत ही अच्छा सर्वे है, बहुत ही मैसिव सर्वे था, 2019 में कराई गई थी। तो these are facts, these are not quoting from hearsay, these are facts. And about 80% are suffering from hidden hunger. Hidden hunger मतलब आपको पता नहीं चलता है कि बच्चे में डिफिशियंसी है। आम आदमी को पता नहीं चलता है कि बच्चे को खून की कमी है। जब एग्जामिन कराते हैं पता चला हीमोग्लोबिन इसकी कम है। फोलिक एसिड होती है, उसके कमी के कारण एनीमिया होती है। जिंक की कमी होती है, B12 के कारण एनीमिया, तो उसकी कमी होती है। विटामिन डी की कमी होती है। और आजकल आज देखा होगा कि जहां भी डॉक्टर की वजह, सबसे पहले विटामिन डी कराओ, B12 कराओ। आपने एडल्ट में हम करवाते ही है, बिकॉज इतनी ज्यादा बच्चों की कमी होती है, तो एडल्ट में कहाँ से ठीक हो। कहीं ना कहीं हमारे खान पीन में बहुत ज्यादा इफेक्ट हो गई है, और उसमें आज के तारीख में जो है जंक फूड का बहुत मेजर कंट्रीब्यूशन है। अभी और लोग, ये तो मार्केटिंग वालों की यही है। साथ में घर में भी आप देखेंगे, फॉलो करेंगे, जो हम लोग खुद भी अपने एज एडल्ट हम लोग फॉलो नहीं करते हैं। ये जो फैमिली, ये जो डाइट है ना, ये फैमिली होती है। आप एक बच्चे को पिन पॉइंट नहीं करते, तो होल थिंग डिपेंड ऑन द फैमिली। और कभी कभी बच्चों में फूड फैट आती होगी। फैट का मतलब कि दे एक ट्रेंड आ जाता है कि चलो मेरे को फैट होता है कि अब मेरे को वेट लूज करना है, या मेरे को मसल बनाना है, मेरे को। आजकल तो हमारे समय तो उतने मस्कुलर हीरो होते नहीं थे। लुक एट महमूद, लुक एट ऋषि कपूर और ये सब। आज की तारीख में तो बड़े इतने ज्यादा मसल, पता नहीं कहाँ से इतने मसल बनाते हैं। बट हमें कभी भी लगता है ये सिनेमा में नहीं होगी, इनको एथलेटिक्स में या वेट लिफ्टिंग में होना चाहिए था, राइट। और प्रॉब्लम ये होती है, वो तो बेचारे मसल बना के घूम रहे हैं, मेहनत भी करते हैं, डाइट भी देखते हैं। हमारी बेचारे जो यंग टीनेजर्स हैं, उनको फॉलो करने के चक्कर में दे काइंड ऑफ फॉल इनटू द प्ले। इधर वो खाना कम करते हैं, ठीक है, डाइटिंग करते हैं, और या फिर गलत तरीके से खाना खाते हैं, प्रोटीन पाउडर लेते हैं, वेट्स करते हैं, उसमें इंजरीज होने का डर होता है। तो काफी नुकसान उसमें होता है, ठीक है। डाइटिंग है कि जिसको आप, बहुत कॉमन चीज एडोलेसेंट एज ग्रुप में होती है, इट इज लाइक स्किपिंग योर मील। तो क्रॉनिक डाइट, ये देखा गया अक्सर। अब बहुत सारे स्ट्रेटेजीज होते हैं, आपने जिसको बोलते हैं क्या बोलते हैं उसको, वेरियस नाम से जाना जाता है। एक फास्टिंग की बात, इंटरमीडिएंट फास्टिंग के नाम से जाना गया है। फिर तुम्हारे गाड़ी की जनरल मोटर डाइट, बहुत सारे जो है ना आपके मार्केटिंग फोर्सेज हैं, उसमें दे ट्राई टू मार्केट कि अभी आप कार्बोहाइड्रेट की मात्रा आपके डाइट में कम कर दो, ये कर दो। एंड ऑफ द डे डाइट आपका बैलेंस होना चाहिए, ठीक है। और साथ में आपका प्रॉपर बैलेंस डाइट के साथ साथ आपके पास प्रॉपर न्यूट्रिशन, प्रॉपर विटामिन, प्रॉपर फ्रूट्स वगैरह होने चाहिए। तो कभी कभी इस डाइटिंग के कारण दिक्कत आती है, और उसमें जो है बॉडी में होती है, साइकोलॉजिकल इश्यूज आती है। लड़की को दिख रहा है कि हम दुबला होना है, या बच्चे को दुबला होना है, दुबले पतले देख रहे हैं, और भी दुबला, और भी कुछ नहीं खाते। सो उनकी जो सेल्फ स्टीम कम होती है, अल्टीमेटली एक तरह की बीमारी होती है जिसको एनोरेक्सिया नर्वोसा भी बोलते हैं, वो एक्सट्रीम फॉर्म में होता है, राइट। और नेक्स्ट स्लाइड, नेक्स्ट, इसमें कि एक एक करके डालिएगा, जिसमें कि एक फोटोग्राफ्स आ रही है, स्क्रीनशॉट आ रही है। कैन यू सी दैट? जिसमें
सर हम लोग कंक्लूजन की तरफ बढ़े तो अच्छा होगा सर।
कितना देर और है? 5 मिनट है मेरे पास।
हाँ सर आगे चलिए।
5 मिनट है ना? ठीक है, मैं कर दूंगा, लोगों पे गाड़ी रोक दूंगा, ये तो पैरेलल टॉपिक चल रहा है, ठीक है। सो कैन यू सी दिस स्लाइड? दिस इज डाइटिंग आई एम टॉकिंग अबाउट। दे नाउ इन द डाइटिंग, नाउ इनके पास एक नवरात्रा के भी डाइट आई। आजकल तो नवरात्रा चल भी रहा है, उसकी एडवर्टाइजमेंट आ रही है, लूज 5 kg इन 6 days। आप बताइए किस तरह का ये पूजा हो रहा है कि नहीं? कैन यू सी दिस स्लाइड?
जस्ट अ मिनट।
हाँ, अब स्लाइड नहीं दिखाओगे तो मजा नहीं आएगा फिर।
आगे
नवरात्रि वेट लॉस डाइट देखो आप।
हाँ सर
दिख रहा है? हाँ, ये वाला, यस। हाँ, इसको स्लाइड शो में डालो। यस। चलिए छोड़िए. नाउ व्हाट आई एम टेकिंग अबाउट जो डाइटिंग मार्केटिंग फोर्सेस के कारण और प्लस लोगों की डिमांड भी है. आज के तारीख में पूजा के समय भी हम उसको मार्केट करके एक प्रोडक्ट की तरह से बेच रहे हैं. और एक एनवायरनमेंट आज के तारीख में बहुत ही बढ़ चढ़ के आ रही है, दैट इज अवर सोशल मीडिया. कमिंग टू द नेक्स्ट स्लाइड, एज यू कैन सी कि हर फैमिली में इज नॉट ओनली चिल्ड्रन, एडल्ट, एडोलेसेंट, सब में है. वी आर काइंड ऑफ एडिक्टेड टू आवर सो कॉल्ड सोशल मीडिया. आज के तारीख में भी आई एम श्योर जो लोग अटेंड कर रहे हैं, बहुत सारे जो आपके स्टूडेंट पार्टिसिपेशन है, इन बिटवीन जरूर अपना व्हाट्सएप खोल के देखना. ठीक है. तो दिस इज ऑन द राइज. ये बहुत बड़ा मेजर इफेक्ट एनवायरनमेंट है, इफेक्ट आप बोल सकते हैं. अल्टीमेटली खासकर ग्रोइंग बच्चे में अगर ब्रेन ग्रोथ जब हो रही है, टू मच सोशल मीडिया विल काइंड ऑफ रिड्यूस देयर ग्रोथ पोटेंशियल ऑफ द ब्रेन. ये फोटोग्राफ, नेक्स्ट फोटो आप देखिए. नेक्स्ट फोटो एक बच्चे की फोटो है. ये इनफैक्ट हमारे यहाँ जो घर में काम करती है 20-25 साल से है. इनफैक्ट इसने ही मेरे बेटे को काफी बड़ा किया. ये इसका छोटा सा बेटा सोने के उठने के बाद ही मोबाइल लेके बैठा हुआ. हम बड़े खुश होते हैं कि बच्चा मोबाइल देख रहा है, बड़ा इंटेलिजेंट बच्चा है. ऐसी बात नहीं है. 2 साल के नीचे बच्चे को स्क्रीन देना ही नहीं है, चाहे मोबाइल हो, चाहे मीडिया, चाहे आपका टेलीविजन हो. इस पे बट मुश्किल होता है. नेक्स्ट स्लाइड प्लीज. सो वी काइंड ऑफ एडिक्टेड टू इंटरनेट. इसको बोलते हैं एक साइकियाट्रिक डिसऑर्डर, इंटरनेट एडिक्शन. आने वाले समय में पता चलेगा कि सोशल मीडिया या इंटरनेट का, कोविड के समय इंटरनेट वाज वेरी हेल्पफुल. दैट काइंड ऑफ सेव्ड आवरसेल्फ, बट एट द सेम टाइम टू मच of anything is bad, and internet is like that. Too much addiction to internet is going to ruin your life in some way or other. एक और इशू है इम्पैक्ट ऑफ इंजरीज एंड वायलेंस. ये मैं एडोलेसेंट बच्चों को खास करके बताता हूँ कि आज के तारीख में इफ यू लुक एट देम, आजकल नॉन कम्युनिकेबल डिजीज की बात करते हैं. 4 डिजीज इंडिया में सबसे कॉमन है ग्लोबली, और इंडिया में सबसे ज्यादा कॉज ऑफ डेथ है. देयर कार्डियोवास्कुलर डिजीजेस, जो कि हार्ट अटैक और ब्रेन स्ट्रोक, डायबिटीज, कैंसर और क्रॉनिक रेस्पिरेटरी, जिसको हम ब्रोंकाइटिस या क्रॉनिक ब्रोंकाइटिस एस्थमा बोलते हैं. और ये 80% ऑफ डेथ लो और मिडिल इनकम कंट्रीज से. लेकिन सबसे इंटरेस्टिंग बात है, इनका जो रिस्क फैक्टर है एडोलेसेंट, जब बच्चा टीन एज में होता है. नेक्स्ट स्लाइड प्लीज. टीन एज में जो है बच्चा, नेक्स्ट स्लाइड प्लीज, टीन एज में लेता है. एंड 4 बिहेवियर व्हिच आर रिस्पॉन्सिबल फॉर दिस NCDs आर tobacco use, harmful use of alcohol, insufficient physical activity, and unhealthy diet, right? Or obesity. Tobacco use or harmful use of alcohol to adolescent age. Most of this behavior are learned behavior, especially in the teenage year. So this is the last opportunity. You can actually modify this behavior so that this teenage can grow up to be a good, healthy adult. Even insufficient physical activity, healthy diet, junk food, बच्चे से ही शुरू हो जाती है. Unhealthy diet at home, too much fatty food, too much samosa, too much Mughlai paratha, all these things in regular basis are absolutely no. So somewhere down the line, you have to take control of that. And physical activity is very important. Now, all of us should involve in physical activity. This is the data from the death. मैंने रेड से मार्क किया हुआ है. नंबर 10 to 19 years के बीच में रोड ट्रैफिक एक्सीडेंट और सेल्फ इन्फेक्टेड इंजरीज आर द मेजर कॉज ऑफ डेथ, राइट? So I'm skipping this interesting slide. Look at the next slide, जहाँ पे गाड़ियाँ दिखाई जा रही है, उस पे आइए आप लोग please. Where we can see the too many cars on the road. Can you see this?
Yes, sir.
This can be from any metro city, be it Kolkata, be it Delhi or Mumbai, or even smaller cities. ये है बाहर की Thailand की फोटो है, but this is from any. This is typical Indian. This is how. So road traffic and injuries, this is again an environmental problem. Either engineering में problem है, या कोई गाड़ी तेज चला रहा है, या कोई रोड ठीक नहीं है, या कोई लाइट नहीं जल रहा है, या रूल्स फॉलो नहीं कर रहा है. These are all, you can say, environment causing the injury. Many of the एक पेशेंट, अगर एक आदमी इंजर्ड होता है, 3 लोग जो हैं उनके जो है बच तो जाते हैं, उनको लाइफ लॉन्ग न्यूरोलॉजिकल प्रॉब्लम होती है, जो कि फैमिली के लिए बहुत, you can say, बहुत कॉस्टली अफेयर होता है. So this is what is happening. अब ये देखिए, तो ठीक है गाय माता होती है, लेकिन ऐसा तो नहीं. रोड के नेक्स्ट स्लाइड जाइए प्लीज. नेक्स्ट टू नेक्स्ट. ये पूजा का टाइम है अभी, ठीक है, पूजा कीजिए, लेकिन गाड़ी रोक के इस तरह से करके आप अगर गाय को ये खिलाएंगे, दिस इज नॉट, आई मीन दिस कैन आल्सो लीड टू एक्सीडेंट, राइट? सो व्हाट आई एम ट्राइंग टू से, एवरी एस्पेक्ट वी शुड बी वेरी माइंडफुल ऑफ अदर पीपल चॉइसेस. ये देखिए नेक्स्ट स्लाइड प्लीज. अब मोटरसाइकिल में 6 लोग जा रहे हैं, 3 2 5 3 4 5 6 लोग. तो ऑब्वियसली एक्सीडेंट्स होगा तो पूरी फैमिली की जो जान है रिस्क में चली जाती है. Coming to physical, last few slides, physical activity, we all know it promotes health, fitness, confidence, and सबसे बड़ी बात है, it self esteem बढ़ाती है क्योंकि हार्मोन सिक्रेशन बढ़ती है, you feel good about it, मसल को स्ट्रॉन्ग करती है, बोन को स्ट्रॉन्ग करती है, and it reduces the risk of developing of obesity and diabetes and heart disease. It is a proven benefit. So every one of us should at least indulge in at least half an hour of, you can say, brisk walking, right? This is very, very important. तो तीन टाइप की एक्टिविटीज होती है, एरोबिक, मसल स्ट्रेंथनिंग एंड बोन एक्सरसाइज. एटलीस्ट आज के तारीख में हमारी हार्ट फाउंडेशन बोलती है वीक में 2.5 घंटा एटलीस्ट 5 दिन आपको ब्रिस्क वॉक करनी चाहिए कम से कम. आप बॉल खेलते हैं, ये सब करते हैं, अच्छी बात है, लेकिन वो भी दैट विल एटलीस्ट हाफ एन आवर. सो ऑल ऑफ यू शुड एटलीस्ट make a habit to do 30 minutes of daily, you can say, brisk activity, right? Brisk activity मतलब 1 minute में 100 steps. This is another message I would like to give to the audience. ठीक है? 60 minutes per day for the adolescent, right? For the children, not for us. हमारे लिए minimum 30 hours. 60 minutes करते हैं तो very good, nothing like it. Coming to other activities now, coming to yoga. Yoga is another advocated activities, and there are various literature. These are published literature I'm talking about. These are all good journals, and they say that yoga contributes limits, you can say, helps to not only for the overall development of physical health but also mental health. It reduces stress, and it is being ये बहुत सारे इनफैक्ट बाहर के देशों में, इंडिया में भी बहुत जगह हो रहा है धीरे धीरे. इसकी जो इम्पोर्टेंस धीरे धीरे बढ़ाई जा रही है. इट इज अ प्रूवन बेनिफिट. सो कहीं ना कहीं जो हमारी ट्रेडिशन इज अगेन, आई एम हैप्पी दैट इज अगेन कमिंग बैक. And with involvement of everyone, we're definitely going to lead a more healthy and happy life, right? I'm not going to detail of yoga, and this is the American Academy of Pediatrics. बच्चों की सबसे बड़ी संस्था है, recommends yoga as a safe and potentially effective therapy for children coping with emotional, mental, physical and behavioral health conditions. Imagine कि जो हम लोग इतने लेट से फॉलो करते हैं, उन्होंने इसको फॉलो कर दिया है. But yes, we are doing it now. Also started following. Last, children and physical environment, जिसकी आज सबको पता है कि बच्चे इधर स्किन एक्सपोजर या इनहेलेशन, इंजेक्शन और या फिर ट्रांसप्लासेंटल माँ को किसी कारण से लेड एक्सपोजर हो गया, मरकरी एक्सपोजर हो गया, अल्कोहल एक्सपोजर हो गया, माँ सिगरेट पीती है तो बच्चे में इफेक्ट आ सकता है. ये पॉल्यूशन होती है. और अल्टीमेटली unhealthy environment give rise to a lot of mortality, and it is responsible nearly 1 in 4 deaths under 5 years. So by reducing environmental risk, we can prevent at least 25% of children death that is less than 5 years. Coming to last key facts. So early life environment affects lifelong health and risk of the disease. Unhealthy environment causes death. Prevention work. So environment using preconception during prenatal life course की बात कर रहा हूँ. Perinatal life, बच्चा जब पैदा होता है, जब बच्चा बड़ा होता है, we can prevent this. So we have to, if we are able to prevent that, we can prevent 13.57 deaths globally. Now with this, I come to the end. So I thank you again. I'm skipping all this thing because I'm coming to the end. And I come to the last slide. Next slide, please. These are some of my patients, which are adolescent patients. They had heart problems because my area is, I am also seeing patients with cardiology. Last slide on the thanks slide. So, and thank you very much. Thank you, Dr. Somesh, and thank you all the senior people for giving me opportunity. I don't know whether I am able to do justice to your talk or not. Thank you so much.
Thank you so much, Professor. We have no words to thank you, in fact. I mean, the way you, we were knowing what is happening around us, but the way you dealt with the micro environment and the way you dealt with the nurture, nature and gene factors, that was something which has gone deep into my heart. बहुत बहुत thanks. और डायरेक्टर कहूँ या मैं प्रोफेसर कहूँ?
नहीं, मैं सीनियर प्रोफेसर को डायरेक्टर प्रोफेसर बोलते हैं यहाँ.
तो ये प्रोफेसर का मास्टर स्ट्रोक था.
मैं तो आपके श्रीकांत हुआ.
हम लोग बहुत बहुत लाभान्वित हुए हैं, and we are so very thankful to you.
Thank you so much. Thank you.
Thank you.